Hi, I'm Professor Kaarin Anstey. I'm very excited to be moving to Sydney and moving my research program, which really looks at the science of ageing well, to NeuRA and the University of New South Wales. So I have a very exciting vision for ageing research over the next 5 years, and I have a program in 4 key areas. The first one is looking at dementia risk reduction, and we've established an international network on dementia prevention to facilitate this, and that's really about knowledge translation and getting the message out about what we can do to reduce our risk of dementia, and working with low and middle income countries to identify risk factors that we share and ensure that all of the research that we're doing is actually being translated into policy and programs to make a change to the future prevalence of dementia. So that's the first one. The second program is around the evidence base for dementia prevention, where we're trying to identify different time periods in the life course where different risk factors are important, and also looking at gender differences. So the differences maybe for women and men in terms of things they can do to reduce their risk of dementia. The third program that we have is looking at resilience and ageing well, and that really focuses around a longitudinal study called the Path Through Life Project, where we're looking at different types of resilience. So we've got cognitive resilience, we've got emotional resilience, and we've got physical resilience. And we can look at predictors, so things that facilitate people to age well and things that hold them back, and develop a life course model to inform the community and practitioners on how people can age as well as possible. Another very exciting and important area is the research program on cognition and decision-making, which is part of the newly established ARC Centre of Research Excellence in Population Ageing. And in that work, we're going to look at how cognitive decline and brain ageing impact on the capacity of older adults to make decisions about their health and finances, and how good decision-making can improve individual lives and society. The final area that I work in that's really exciting is looking at older drivers and road safety. So a lot of the approach to older drivers has been around regulation and licensing, and we think there's huge scope for research to develop interventions and technology to increase older driver safety and keep them driving. So we've developed several interventions in that program. We've got vision to develop more and to implement them, make them available to consumers. This work is important because we have an ageing population. I mean, by 2050, 1 in 5 Australians will be 65 or older. Of those adults, probably 20 to 25% will have either cognitive impairment or dementia. So 5 to 7% will have dementia unless we identify ways of preventing cognitive impairment and dementia through either drugs or lifestyle modification. Look, it's a really, really exciting time to be working in ageing research and in dementia research in Australia. There's new breakthroughs coming through. We're developing interventions to improve the way people age. It's become an issue that's at the forefront of public policy. There's the recent launch of the World Dementia Observatory, and so I'm really excited about moving into this space at NeuRA and University of New South Wales, where there's outstanding scientists, outstanding infrastructure, and there's a lot of excitement and energy, and it's a real place where my team will grow, and there's a lot of opportunity here.